China's financial hub of Shanghai launched a two-stage lockdown of its 26 million residents on Monday, closing bridges, tunnels, and restricting highway traffic in a scramble to contain COVID-19 cases. The snap lockdown announced by the local government late on Sunday will split China's most populous city, roughly along the Hongbu River, for 9 days to allow for staggered testing by health workers in white hazmat suits. It is the biggest COVID-related disruption to hit Shanghai and sent prices of commodity including oil and copper lower on fears that any further curbs could hit demand in China, the world's second largest economy. Residents east of Hongbu were confined to their homes. Some said healthcare workers arrived to conduct tests as early as 7 a.m. on Monday. Those in the west rushed to stockpile food and other goods as they are prepared for a similar fate. From April 1st, delivery services were overwhelmed and supermarkets ran low on supplies. Several social media users posted images of what they had managed to buy. Many wholesale markets are now closed, Bi Yungwu, a 50-year-old stallholder, said. Some vendors are reluctant to buy in vegetables if we cannot get vegetables from wholesaler or the wet market is closed. We are finished, he said. The curbs marked a turnaround for Shanghai authorities who recently, as Saturday, denied the city would be locked down as it pursued a more piecemeal slicing and grading approach to try to gain the upper hand in the fight with the infection disease. Wu Van, a member of Shanghai expert COVID team, said recent mass testing had found large-scale infections throughout the city, triggering the stronger response. Containing the large-scale outbreak in our city is very important because once infected, people are put under control. We have blocked transmission, she told in a briefing. Infection and death numbers are low by global standards, but China has imposed a zero COVID policy that has all but closed its borders to travelers for 2 years and rushes to shut off every chain of infection. Shanghai recorded a record 3,450 asymptomatic COVID cases on Sunday, accounting for nearly 70% of nationwide total, along with 50 symptomatic cases. Shanghai said earlier this month its daily testing capacity was around 3 million, but Shen Yixin, a doctor in charge of a city quarantine facility, warned it still might not be enough to outpace the spread of the virus. When cases numbers reach such a level, the difficulty of relying upon previous staff deployment increases by a large degree, he told government newspaper Liberation Daily. The new lockdown should at least ensure the steadiness required to bring the outbreak under control, he added. Wu had told a briefing on Saturday that Shanghai could not be locked down for long because of its important role it played in the national and even global economy. But following Sunday's upward turn, mass testing disrupted transport, healthcare, and a wide range of economic activities, with citywide land sales also halted on Monday. Shanghai Public Security Bureau said it was closing cross-river bridges and tunnels and also highway toll booths concentrated in the city's east until April the 1st. However, ports and the city's airport remain open as yet.